It's very important to know your numbers, otherwise you have no idea if you're at risk for heart disease. High blood pressure, high cholesterol, and diabetes are all silent killers. They may have no signs or symptoms until you have your first clinical event, which could be stroke, heart attack, or even death. So one way to kind of learn about this is simply go to your doctor, get some blood work done, have your blood pressure measured, and then you'll know if you're diabetic, you'll know what your cholesterol level is, and you'll also know what your blood pressure is. Another thing that I often get is very young people who say they have nothing to worry about. They're young and healthy. What we found already is that fatty streaks in your arteries develop even before you're born. So while you're in your mother's womb, people are already putting down fatty streaks in your blood vessels. So everyone is at risk for clinical heart disease. The other thing I get is young females who are thin, pretty, who say they have nothing to worry about. There's something that we call TOFI, T-O-F-I, and that stands for thin on the outside, fat on the inside. And that comes from looking at supermodels. They may look skinny, but they have no muscle definition. They actually have high body fat composition, and they have much higher risk of developing high blood pressure, diabetes, metabolic syndrome, high cholesterol, and then clinical diseases such as heart disease. So getting to know your numbers is critically important.